Ladies and gentlemen, good evening. Thank you very much for gathering in the evening, and I'm sorry for having kept you waiting for a while because of the prolonged the previous meetings all the briefers attended. My name is Kamoshida Naoaki. I'm the director for International Press Division of the Ministry of Foreign Affairs, and I'll serve as a moderator for today's press conference. The simultaneous translation is provided, so please tune in channel 1 for Japanese and channel 2 for English. First, let me introduce today's briefers. Next to me is Mr. Noda Hiroyuki from the Cabinet Secretariat. He's Counselor, Coordination Office of Measures on Emerging Infectious Diseases. 私の隣に座られているのが内閣官房から
We have Noda-san, Counselor, Coordination Office of Measures on Emerging Infectious Diseases of the Cabinet Secretariat.
And from the Ministry of Health, Labor and Welfare, we have Mr. SAHARA Yasuyuki, Senior Assistant Minister for Global Health. 厚生労働省
From the Ministry of Health, Labor and Welfare, we have with us SAHARA Yasuyuki-san, Senior Assistant Minister for Global Health.
Director, Department of Health Crisis Management, National Institute of Public Health. SAITO Tomoya.
SAITO Tomoya-san, Director, Department of Health Crisis Management, National Institute of Public Health.
SUDA Toshiyuki, Director of the Environmental Health and Food Safety Planning Division.
SUDA Toshiyuki-san, Director, Environmental Health and Food Safety Planning Division.
Kazuho, or Director, Office of Global Health Corporation, International Affairs Division.
TAGUCHI Kazuho-san, Director, Office of Global Health Corporation, International Affairs Division.
And Mr. Kato Takuma, Director, Measures on Novel Influenza Control Office. Kato Takuma, 新型インフルエンザ
Kato Takuma-san, Director, Measure on Novel Influenza Control Office.
From the Immigration Services Agency, here with us Mr. Umehara Yoshihiro, or Deputy Director of the Inspection Division. 出入国在留管
Umehara Yoshihiro-san is the Deputy Director, Inspection Division of the Immigration Services Agency.
Foreign Affairs, we have Mr. Ozaki Sotaro, who is a counselor at the Japanese Embassy in South Africa, but currently assisting the Consular Affairs Bureau. 現在、領事局の方に応援で
Ozaki Sotaro is now in Tokyo. He's a counselor of the South African Embassy, but currently helping us out at the Consular Affairs Bureau.
This conference is given on the record, so you can quote the name and title of the briefers. So today is press conference is about the responses to the novel coronavirus diseases. And first, I will ask colleagues from the Ministry of Health, Welfare and Labor about the status of infection and the PCR testing. Then also I will ask our relevant colleagues to explain about the border control measures from the Immigration Services Agency, Ministry of Foreign Affairs and Ministry of Health. And also we will hear explanation from the Cabinet Secretariat about the Special Measures Act. Then I will open the floor for questions. And when you ask questions, please raise your hand and specify your name and affiliation before asking a question. So now I would like to invite Mr. Sahara to make introductory remarks.
Good evening, ladies and gentlemen, and thank you very much for being here this evening. I will very briefly update you on the general situation. As of yesterday, domestically, the number of domestic patients was 488. PCR positive patients, the number was 488. In the past couple of days, or for more than 1 week, we have been seeing increase. But although there has been fluctuation, but on average, we are detecting 30 cases per day. That's the rate of increase on daily basis on average. On February the 24th, the novel coronavirus response experts meeting was held, and on that day, the experts gave the following opinion, which was shared with you at the previous briefing. At that stage, they were saying the following. In Japan, the crucial timing would be the next 1 or 2 weeks, and that would determine whether there would be rapid increase of spread or whether the outbreak will be concluded and end. And since various measures have been implemented in Japan, and the number was just mentioned by myself, but again, the experts meeting was held yesterday, and the opinion of the experts at yesterday's meeting was as follows. As of yesterday, the Japanese situation cannot be described as explosive outbreak or spread of infection. To a certain extent, the spread of infection is being controlled. However, it is not possible to relax the level of monitoring and caution. So this evening, I would like to describe the situation. This is the situation we are in, but we are discovering clusters where we find concentrated infection in certain localities. And at the beginning, I would like to explain to you the situation of clusters. After that, we will take up the situation of PCR tests. Last week on Friday, since Friday, this became subject to the public medical insurance system. So it's under insurance coverage, and I will speak about that later on. And after PCR tests, as was explained by the moderator, border measures will be explained not just by our ministry, but MOFA as well as the Immigration Services Agency shall also take the floor. And at the end, the Special Measures Act on pandemic influenza will be described. To a certain extent, the outbreak has been under control, but crisis management is all about assuming the worst case scenario to be well prepared. So based upon that kind of worst scenario assumption, we are planning to have legislation in place. So that will be taken up as the final item of the presentation. To begin with, first of all, the spread of infection in Japan. Dr. Saito will take the floor.
I'm Tomoya Saito from National Institute of Public Health, and now I work for the Cluster Response Task Force in the Ministry of Health headquarters for responding to COVID-19. And let me briefly describe the epidemiological situation and our work on the Cluster Response Task Force. As of yesterday, I have a little bit updated number compared to Dr. Sahara previously mentioned. We have 498 cases, including asymptomatic cases. And I'd like to let you know that we published the English the map plotted, which has the number of the patient in each areas. each prefectures, and this is can be accessed through the MHLW's website, the English page, and it will be daily updated. The number here, the 446, is the symptomatic cases. So it's the 498 minus 52. Here is a 446. This is a symptomatic patient. This figure will be updated daily. And we have found at least one patient in 34 prefectures. And age distribution of the cases are mostly in 40s to 70s. And we have several young cases, less than 10 or 10 to 90s, but it's very limited. And the severe cases are mostly in the age of more than 60. But we have some severe cases even in younger ages. And as Dr. Sahara mentioned, the number of patients is increasing, but very slowly. It's not explosively. So we are taking very good control measures at this moment. And we understand that in the early 100, the analysis of early 100 cases, most cases does not infect others, but some infects more than 5, and they form the cluster, so-called cluster. So at this moment, we have identified the 9 major clusters. It's showed in your handouts here, mapped out like this. And some clusters are still ongoing, but some are already stamped out, and we have not seen the patients last 2 weeks. And so to contain these clusters, we dispatched some assistant team, including the expert of the epidemiological investigation, to 6 prefectures, to Hokkaido, Chiba, Kanagawa, Aichi, Osaka, and Kochi prefectures. So our strategy is the so-called cluster-focused approach, and we assume that the linkage of these clusters and the chain of clusters is the behind the scene of this current epidemic. So our resources are more focused to the containing the clusters to control the epidemic. So through the epidemiological investigation in the field, we trace the contacts, and we identify the source of infections and intervene the sources or the and try to stamp out the linkages between the clusters. And our work is also to identify the risk factors of places where there are large spread may likely occur. And we identified the 3 factors. This was mentioned in the, yesterday in the expert committee. But one is the closed and the unventilated environment. The second is a close contact, and third is the people where the people have a conversation or singing. These 3 factors are the risk factors in the environment to make a cluster. So we are allowing people to avoid such factors since last week. So that's our current activities on the cluster-focused approach. Thank you very much.
Next, I would like to address the PCR tests, the new approach to PCR tests. Allow me to give you some explanation. as material, we have distributed to you 2 sheets of paper. First, please refer to page 1. PCR testing system for novel coronavirus covered by medical insurance. Please refer to this document. You can find points. The first point, the public health center. If a public center health center decides that the patient is out of the scope of administrative testing, doctors can request the test directly to testing institutes with their own decision. Last Friday, since March 5th, under the Japanese public medical insurance, PCR tests can be performed. So in the past, the consultation with public health center was necessary, and when the doctor deemed it necessary, then the PCR test was performed. But from March 5th, consultation with the public health center is not necessary anymore. The private testing institutes can perform a PCR test once the doctor makes a decision that the PCR test is necessary. So fully reliant on the doctor's professional judgment. Then the second bullet, for the purpose of preventing in-hospital infection and ensuring the accuracy of the test is required to be conducted at outpatient facilities for Japanese returnees and potential contacts. I think this is a very important issue. At all the medical facilities, conducting PCR tests would not be appropriate. That is our line of thinking. The medical facilities have elderly people, those people who have underlying diseases, or the cancer patients, various kinds of people are there in those medical facilities. So such people and those people who have come to be examined for the possible coronavirus infection, we would like to do them separately, address them separately, and we thought that was necessary. So regarding these tests, and it used to be so in the past as well. There are about 900 medical facilities that have outpatient facilities for Japanese returnees and potential contacts. So they were the professional facilities to handle them. Where can you find these outpatient facilities with regard to such information? Although this is not disclosed to the general public, above the outpatient facilities, you can find the call center for Japanese returnees and potential contacts. So please call this call center for Japanese returnees and potential contacts. And then your nearby medical facilities will be given to you by the call center. And in advance, you are expected to make a phone call to outpatient facilities and make an appointment with the outpatient facilities, so that the medical facilities, clinical hospital can be well prepared before having a patient. And we would like to continue to handle the patients in this way. The third bullet point. Moreover, the efforts will be made to expand the number of tests to be conducted with insurance coverage, taking into account future improvement in the preparedness of the private sectors. The private testing institutes will be encouraged to participate to perform PCR tests. So the number of facilities, institutes who can handle the PCR test, we would like to see the increase of those institutes. And of course, the private testing institutes were part of the picture, but from last Friday, with the doctor's judgment, we now having a more flexible system. And as for the private testing institutes, the capacity as a whole of Japan, we would like to see the increase of the capacity. Please refer to the second page. The novel coronavirus test capacity and the number of cases tested. Regarding the PCR tests, the capacity for the novel coronavirus test, you can see that it has been on the increase. You can find the line graph on the bottom. That's the number of tests performed on a day-to-day basis. You can see here the green color-coded or purple color-coded area. This shows the nationwide capacity, Japan's capacity per day, the number of cases that can be performed. So it shows the capacity. Until last week, it was about 4,000, but from the beginning of this week, it's exceeding 6,000. That's the capacity that we have nationwide. By the end of this month, we would like to increase it to something close to 7,000 by the end of this month. Concerning the numbers, down bottom, you can see this is the decrease. You can see the decrease because it was the weekend. But compared with the capacity, you can see the capacity is higher than the required number of cases.
So, by having such system in place, we will be providing for opportunities for people to receive tests. Thank you for your kind attention. Shall we go on to border measures? Yes. On behalf of the Immigration Services Agency, I would like to take the floor to explain to you the border measures. My name is Umehara of the Immigration Services Agency. What I will be explaining are measures that our agency is implementing based upon the Immigration Act. Immigration Services Agency entitled one-page document should have been distributed to you. Based upon the Immigration Act, these are the restrictions that we have put into place. There are 3 subject groups to which we are implementing these measures. Going on from the first bullet point, foreign nationals who visited certain places within 14 days before the date of arrival in Japan will be denied entry into our country. The specific locations subject to this measure is indicated. Some provinces of China, Hubei province and Zhejiang province, and certain cities of Republic of Korea, including Daegu Metropolitan City, and certain provinces of Iran, 3 provinces of Iran. If the person stayed in any of these areas within 14 days before the date of arrival in Japan, they would be denied entry. Next point. Next bullet point. Holders of passports of the People's Republic of China issued in either Hubei or Zhejiang province will be denied entry into Japan. The final bullet point. Foreign nationals who boarded the Westerdam that left Hong Kong and disembarked the vessel will be denied entry into Japan. These measures are in place. Westerdam was traveling towards Japan to enter into Japan in early February, and there is suspicion of outbreak of novel coronavirus on the ship, and that is why we've taken the 3rd measure. And these are the 3 groups of people to whom we are denying entry, but if there are exceptional circumstances, we are granting them entry rights. More specifically, for the first group of people on the first bullet point, for example, the second bullet point, Hubei, Zhejiang province issued passport holders who had not visited any of the areas in the first bullet point, like Hubei province and Zhejiang province. Those are the places where the passport had been issued, but they weren't there during the past 14 days. So the person was in the United States during the 14 days before date of arrival in Japan. Then those people would be granted exception and be able to enter into Japan. So that concludes my explanation on the border measures implemented by the Immigration Services Agency.
Sotaro Ozaki, and I am currently working in the Consular Bureau of Ministry of Foreign Affairs. I will explain to you the new visa restriction measures. Last Friday, the Japanese government made the cabinet agreement on further governmental measures to drastically strengthen border measures. These measures were decided to continue implementing flexible border controls without hesitations at this extremely critical time amid the further spreading of infections in foreign countries. So the measures include following visa restrictions. The number one is that the validity of single visa or multiple entry visa issued by March 8th by Japanese embassies or consulate general in China, including Hong Kong and Macau, or the Republic of Korea. And the validity of these visas was already suspended from the beginning of this week. And the second measure is that the visa exemption measures for Hong Kong and Macau and the Republic of Korea was also suspended from the beginning of this week. These measures will last until the last day of the March. But this period may be renewed. So the consequences of these measures foreign people will not be permitted to enter Japan from this week. Namely, the first category is that the people who intend to enter Japan with single or multiple visa issued by March 8th by Japanese embassies or consulate general in China or the Republic of Korea. Because as I said, the validity of these visas was suspended. And the second category is that the people who possesses a passport issued by Hong Kong or Macau or the Republic of Korea and intend to enter Japan without obtaining a visa. Because, as I've said, visa exemption measures for Hong Kong, Macau, and for the Republic of Korea was also suspended. So please check regularly our homepage of Ministry of Foreign Affairs. Thank you very much.
I'm with the MHLW since yesterday, 9th of March, up to 31st of March. Those who arrive in airport or vessel to Japan from China or Korea are requested two things. First of all, those who arrive from China or Korea by plane or by vessel, regardless of nationality, we are requesting them to stay at a place designated by the quarantine station chief for 14 days. This applies to people who are staying for longer than 14 days, like 20 weeks. And we're asking them to stay at the place for 14 days. But for those who are planning to stay only for a couple of days, they are asked to stay in that designated place for only the duration of their stay. And the second request is not to use public transport. So those are the requests offered by the quarantine station of Japan. That's it. Thank you. I'm from the Cabinet Secretariat, and this morning there was cabinet agreement on the amendment of the Special Measures Act for Pandemic Influenza, which will be submitted to the Diet. Special Measures Act on Pandemic Influenza and New Infectious Diseases Preparedness and Response is an already existing act. 10 years ago, in 2009, there was the pandemic influenza pandemic, and this act was enacted based upon the lessons learned from that experience. The overview of the act is described in the one-page leaflet in English that has been distributed to you. This covers pandemic influenza and new infectious diseases. At normal times, the act would require the formulation of action plans and stockpiling of supplying and goods and implementation of border control measures.
And when there is a declaration of emergency situation, after that, the emergency measures can be taken. That's stipulated in this act. Regarding the emergency measures, let me describe some of them. In principle, when the governor of prefecture that sees a large the spread of the disease, it receives a certain authority, requesting people to refrain from going out, and also the requesting the holding and issuing an order to restrict the holding of events, the emergency permission for the use of temporary medical facilities, extending the expiration date of licenses, for instance, driver's license. So by requesting and issuing an order to restrict the holding of events, the extending the expiration date of driver's license becomes also possible under the Act. So with regard to those special measures, the private rights are restricted in certain cases. So the judicious and careful operation is necessary. In terms of the system of this law or act, from the MHL, the minister, to the Prime Minister, the occurrence of infectious disease is reported to the PM, and the headquarters are established to address that issue. And after that, this declaration emergency situation is made. For instance, if the disease is serious, and nationwide, the rapid spread is observed to the lives of the people, to the national economy. The impact is held, or there's a risk of impact in the people's lives or the national economy. Then the declaration of emergency situation is made. At each stage or each phase, experts' inputs are gathered, and then the judgment is made. So step by step, very steadily, the judicious decision is made. That much is stipulated in this act. Previously, as you heard from the MHLW, in terms of epidemiological situation here in Japan, the explosive spread of the disease is not observed. We are still holding up to a certain extent. Yesterday, the expert meeting was held, and that was their opinion. That being the case, regarding this act, regarding this the new. In terms of our preparedness for the new coronavirus, the infectious disease, so this is for the preparedness. As for the minister in charge, last week, Minister Nishimura became the minister in charge starting next week at the Parliament in the National Diet. He is addressing the matter. At the risk of repeating myself concerning this act, as I said at the outset, novel coronavirus and new infectious diseases were the scope of this, but with the revision of the measure, the new coronavirus infectious disease should be falling into the scope. That's the background of the submission of this bill to the Parliament. The deliberations in the Diet will follow. And in the Diet, if the bill is passed, still at each phase and each step, experts' input will be gathered, and the measures will be made at each stage. So these are the procedures for the future. For the future, and I hope you will understand that. Thank you for your kind attention.
These are the updates about the status of infection, PCR testing, border measures, and the Special Measures Act from the relevant ministries and agencies. Now, I would like to open the floor for questions, but when you ask a question, please raise your hand, and please use a microphone because we are using the translation, and say your name and affiliation. The floor is open. Ms. Rich.
Thank you for holding this briefing. I'm Motoko Rich from the New York Times. I think this question is for Sahara-san. I'm looking at this chart about testing, and we've asked at the last two briefings about the increasing capacity, which this shows, but it doesn't show much of an increase of actual testing. So I'm wondering if, given that even though the increase in cases is only an average of 30 a day, that's against a backdrop of no